Story 1. For years I occasionally had a strong odor from my navel and some reddish-brown discharge. Cleaning it thoroughly caused pain and increased irritation. By the time I thought to ask a doctor, the symptoms had often gone away. Eventually it happened more often, and I grew tired of the odor and of being extra careful with high-waisted clothes, so I asked my primary care physician. They referred me to a dermatologist, who could not determine the cause but found some unusual bacteria. The dermatologist sent me to an infectious disease specialist, who also was unsure but ordered a computed tomography scan. The infectious disease doctor then stopped responding and their office closed. I never heard from them again after my scan, and their number was disconnected. I received my scan on a disc and decided to contact a general surgeon. The surgeon took one look at the scan and knew immediately. It turned out I was born with an extremely deep navel that extended almost to the muscle, and the skin at the bottom was chronically infected. When I moved a certain way, the tissue would reinfect itself, causing odor, discharge, and skin irritation. The surgeon accessed the area through the base of my navel, removed the infected tissue, closed it, and reconstructed a much shallower navel. That was 5 years ago, and I have had virtually no problems since. It was a long journey to get there, and I regret spending so much time worrying and feeling ashamed of the odor. Story 2. My mom kept forgetting things like leaving items in the oven, and I joked that she had early onset dementia. I finally bullied her into going to the doctor, and it turns out she has a thyroid issue. Story 3. I had terribly painful canker sores all my life and thought I had a genetic condition or immunodeficiency. It turned out I had a sensitivity to an ingredient in most toothpaste, sodium lauryl sulfate, which causes canker sores in many people. If you have canker sores, try switching to Sensodyne. It could be life-changing. Story 4. I finally saw a doctor because I was in despair over my mental health. I had a new job I wanted to keep, and the anxiety and panic attacks were becoming a real problem. He asked whether my eyebrows were thin and whether I had hair loss, tiredness, sore joints, dry skin, memory loss, constipation, and other symptoms. He ordered specific blood tests. They showed hypothyroidism due to Hashimoto's disease. I had no idea how long I had been attributing my symptoms to environmental factors such as stress and fatigue. I now take a daily dose of a simple, inexpensive thyroid hormone, and it has changed my whole life. Story 5. I had a nagging cough. My vision was blurry, my ears were ringing, and I was always tired. Turns out I am iron deficient and anemic. Now that I take iron supplements, I feel better. Story 6. In my early 20s, I loved drum and bass. The morning after a gig, I woke up with no hearing in my left ear. I thought I had gone deaf. I had been dancing in front of the speaker and was in an altered state of mind. I worried for a few weeks before finally going to the doctor. The bass had moved a piece of earwax in front of my eardrum. After a quick suction, I was back to full hearing, but I did develop persistent tinnitus from my party days. Story 7. In college, my hair began falling out and I started getting sick frequently. Terrified, I finally found the courage to see a doctor. He asked about my diet and I said rice and tuna. He asked what else and I said that was it. He said, "You dummy, don't do that." Story 8. I was told I was bipolar as a teenager. Medications never worked and usually made me feel worse. I gave up on medications and therapy in my late 20s. I was talking to my gynecologist at an appointment, and she told me to start tracking my mood with my menstrual cycle. I received a diagnosis of premenstrual dysphoric disorder at age 36. Story 9. I had a black lump in my armpit. I thought it might be cancer or something serious. I finally went to the doctor, and she was an elderly Japanese woman. She said, "Watch this." She smacked my armpit, told me to hold out my hand, and placed a pea-sized sebaceous cyst in my palm. She said, "Merry Christmas," and walked away talking on the phone. I just sat there with the cyst in my hand that she had just removed. Story 10. During the coronavirus disease 2019 pandemic, I unexpectedly gained a lot of weight. It was iodine deficiency. I just needed table salt. This was caused by cooking at home a lot using pink salt, French salt, black salt, smoked salt, and other specialty salts. Story 11. I had severe anxiety and depression, even though I had been taking antidepressants for years. I was getting in trouble at work for not being able to focus or stay on task. I thought it was because I was always on the verge of an anxiety attack. I told my doctor that it was causing trouble at work. He asked, what if your anxiety is caused by your inability to focus, not the other way around? He prescribed Adderall. It turned out I have attention deficit hyperactivity disorder, and I had been anxious and depressed because I was exhausting myself trying to cope with my symptoms on my own. Story 12. For a year, I had extreme tiredness, brain fog, painful joints, weakness, and struggled to function. I couldn't stay awake for a full day and could not concentrate on anything. It turned out to be vitamin deficiencies, mainly iron, vitamin D, and vitamin B12. I expected something seriously wrong because of how awful I felt, but it turned out I needed to take vitamins. Story 13. I had a scary-looking mole on my hip that I ignored for years because it appeared one day and stayed the same. It never hurt and never changed. Blood would pool underneath it whenever it was irritated by my clothes or when my husband accidentally grabbed it while reaching for my hip. Finally went to the dermatologist, and it turned out to be a cluster of blood vessels, not cancer. They numbed the area, the doctor used a scalpel, and it was done within 3 minutes. The worst part was seeing the room labeled surgery room and feeling awkward in the chair while showing him my hip. Story 14. I had terrible heartburn almost daily, after only having it once or twice a year before. I became extremely fatigued, experienced constant brain fog, and was nearly unable to function. Then my appetite disappeared, which was especially concerning because I have always loved to eat. I saw my primary care physician and had several tests. They suspected Helicobacter pylori or the onset of diabetes. It turned out to be, at age 33, my first urinary tract infection. I had none of the classic urinary tract infection symptoms. Urination felt completely normal. My doctor explained that can happen and that an untreated urinary tract infection can cause those other symptoms. I took a course of antibiotics and returned to normal after months of needless suffering. Story 15. I had a strange pain in my neck and the lower back of my head. I thought it might be a tumor or a blood clot. I finally had it checked, and a nerve running through that area was pinched, which was causing the pain. Story 16. I have had anxiety for the better part of my life. As I entered adulthood, I began having panic attacks, and it felt increasingly difficult to manage. I had tried various anti-anxiety medications and antidepressants, and the results were fairly mediocre. Eventually, I saw a different psychiatric provider. While I was rambling, she asked, "Has anyone ever mentioned attention deficit hyperactivity disorder to you? I think a lot of your anxiety may be coming from that." At first, I did not think that could be right, and I was nervous to try medication, thinking a stimulant would make me much more anxious. But it was a night and day difference. I have not had a panic episode, and my overall anxiety has been drastically reduced ever since. Story 17. I had neuropathy in my feet that would come and go and feared it was diabetes because everyone on my father's side has diabetes. The tests always came back normal, and the doctor would just shrug and tell me to exercise more. Finally, a new doctor asked if I had ever been checked for vitamin deficiency. I was severely deficient in vitamin B12 and also deficient in vitamin D, although vitamin D was not the cause of the neuropathy. I received vitamin B12 injections for a few months until my levels returned to normal. Then I maintained them with over-the-counter vitamin B12 supplements. The neuropathy comes back when I do not take them and goes away when I am consistent. I would take vitamins over having diabetes any day. Story 18. Pain during intercourse. My grandmother died of cervical cancer at age 50, and with colon cancer on the rise and a history of blood in my stool the year before that had been dismissed, I naturally imagined the worst. My first doctor said it was probably stress or possibly polycystic ovary syndrome and dismissed my concerns for 3 years. After I moved, my new doctor referred me to a physical therapist. It turned out I had a hypertonic pelvic floor. My pelvic floor muscles were continually contracted and too tense to relax. After 1 month of physical therapy exercises, the pain was completely resolved. It taught me the importance of finding doctors who listen and use their full care team. Story 19. Starting around age 8, I had chest pain to the right of what would become my left breast. Growing up, I had heard stories of my uncle who died at age 10 from a heart condition, and I was absolutely 100% certain I was dying. I prayed and begged for more time from God. However, I did not feel safe telling my mother and grandmother because my uncle had not been allowed to do anything. They would not let him run, walk up and down stairs, take any physical class, and he was not allowed to sing. I loved dancing, and I was sure that if my parents brought me to school in a wagon or insisted on carrying me upstairs the way they had for my uncle, I would probably be beaten to death by classmates who already bullied me heavily. So I did not tell anybody. In my 30s, I found out it was mitral valve prolapse and not a big deal, but goddamn. Story 20. My hair spontaneously turned strawberry blonde from dark brown after surgery and 4 days in the hospital with a complication. I went to 3 doctors, and one of them consulted her mentor. No idea. Blood was drawn to see if the surgery could have caused it. By the way, very few things spontaneously change hair color. I also had minor breathing issues at the same time. This was February 2020. We had heard about that strange virus. The mystery was solved when I finally noticed my boyfriend, who has very dark black Asian hair, had the tiniest streak of red. We discovered that he had been putting laboratory-grade hydrogen peroxide into the oil diffuser to kill bacteria. I was not worried until he pulled out the bottle because I had assumed he could only buy drugstore strength. I am a chemist. So basically, my boyfriend accidentally dyed my hair, and doctors could not figure it out despite many laboratory tests. It was embarrassing to tell them. Story 21. I flew out to help my daughter with her new baby and woke up on the second day to the world spinning and violent nausea whenever I moved. I had to crawl to the bathroom because I couldn't stand without falling. I crawled back into bed. After 4 hours, I was going to have my daughter drive me to the emergency room when I started searching online. The first result was vertigo and a YouTube video about the Epley maneuver. Took about 3 attempts, but within 10 minutes I felt fine. It was caused by a small crystal in the inner ear becoming displaced. Story 22. I went to my doctor after years of steadily worsening stomach issues. Diarrhea several times a day, significant bloating after eating, stomach pain, and unexplained weight gain no matter how little I ate. My mom had thyroid cancer in her 20s, so I was terrified I had thyroid problems. My doctor put me on a low fermentable oligosaccharides, disaccharides, monosaccharides, and polyols diet that I followed for 4 months and discovered I am gluten and dairy intolerant. I had previously eaten lots of bread and pasta every day, and as soon as I cut them out, every symptom disappeared. I lost about 15 pounds over the next year without really trying. Story 23. I used to race bikes and trained a lot. For years, I had episodes of what seemed like sciatica in one leg. I saw my primary care doctor, was referred to an orthopedist, and had a magnetic resonance imaging scan, but nothing unusual showed up. I then did months of physical therapy with no improvement. I later saw a sports physical therapist who gave me a few exercises and said the strength in my stability muscles was lacking. I was very strong in muscles that generate power, but my core and stabilizers were weak. My fast-twitch muscles were compensating, causing pinching sensations and cramps. I am no longer racing but still maintain core work. Story 24. I had a large lump on my buttock for years that made sitting uncomfortable, but I ignored it. I worried it might be serious, but it turned out to be a fatty lump, possibly a lipoma. I had surgery to remove it, and now I have a scar on my buttock. Story 25. I had issues with mood stability and frequent meltdowns. I experienced either intense anger or crying spells as if someone had died. I was very anxious and increasingly struggled to connect with other people. Work became difficult, so I saw a psychiatrist. I thought I had the family curse of bipolar disorder. That led to 4 years of constant medication adjustments because the treatments were not effective. Last month, at age 24, I was diagnosed with autism. It makes perfect sense, yet no one had noticed. My younger brother was diagnosed about 10 years earlier, but no one had considered that possibility for me. Story 26. I have been forgetting words, distant family members' names, tripping over words in my mouth, and switching words in sentences. For example, I might say, "Are you getting any naps?" Or "Do you want to take a nap?" I type paragraphs and realize I only thought I wrote a word, and I often seemed to be missing one or two words in sentences. I also began forgetting important things I never forgot before, such as leaving the freezer open all day, leaving the stove on, or leaving a candle burning. I have had constant tripping, eyelid drooping when I am tired, and vertigo. I was really concerned I had multiple sclerosis or a brain tumor. One of my night shift attendings noticed the eyelid drooping one day and suggested I speak to a neurologist. I put it off for years because I did not want to know. After I had my son, I finally decided it was time to find out. Neurology did a full workup. They performed magnetic resonance imaging, computed tomography angiography, and a full range of blood tests. The diagnosis was attention deficit hyperactivity disorder. I work in psychiatry. I did not expect that. As for the eyelid drooping, they are not sure why. It appears to be congenital. Lyme disease and myasthenia gravis were ruled out as well. I am glad this highlights real concerns that come with attention deficit hyperactivity disorder. Please talk to someone if you think something is wrong. Took me more than a decade to finally get checked. Story 27. I felt pretty depressed and had low energy. I woke up feeling like I could sleep another 12 hours. I worked out constantly but never retained any muscle. If I took a week off from the gym, I would lose any progress I had made. Working out left me completely exhausted. I felt very irritable, and my anger was so intense that I had to restrain myself from saying hurtful things. It was hard not to snap at people. I had many tests done, iron, potassium, thyroid, and other tests, and everything was normal. I even thought it might be related to my childhood trauma. I went to therapy and still felt terrible. I had a male doctor during this entire process. I wondered whether my birth control was the cause, but he said that was not possible. I saw a female doctor and we tried stopping my birth control, the NuvaRing. She was a godsend. I feel back to normal now. I still feel worse for about a week each month, but that beats feeling horrible all the time. I feel human again. Sometimes it makes me sad that I lost 2 years of feeling normal because the doctor did not suspect it was an issue. Story 28. I had a breast lump and changes to the appearance of the nipple, which they said was very concerning. I went to the doctor and had several mammograms with contrast, 2 biopsies, a couple of ultrasounds, and 3 magnetic resonance imaging scans. The conclusion was fibroadenoma and a couple of cysts. I had blood in my stool and severe cramping. I underwent a colonoscopy and an upper endoscopy. The findings were internal hemorrhoids and irritable bowel syndrome. I had agonizing pain in the upper right quadrant of the abdomen, severe acid reflux, periodic loss of appetite, nausea, and vomiting of bile. Tests showed gallstones and gallbladder inflammation. My gallbladder was removed and symptoms improved significantly, with only occasional discomfort if I eat something very unhealthy. I have major health anxiety, so all of these situations were an emotional roller coaster. I worry that everything is cancer. Story 29. I have been dealing with fainting spells since I was a teenager. They started to get worse, so I went in for an evaluation. I was told that I just faint, laughing out loud. There is nothing to be done about it except to get on the ground when I feel it coming on. Still worries me, but I'm not dying. It's just scary and disorienting when it happens. Story 30. I went to the emergency room for acute abdominal pain. I was convinced I had pancreatitis, cancer, or that my gallbladder needed to be removed. $15,000 worth of laboratory tests and a computed tomography scan with contrast later. The doctors told me I had likely pulled an abdominal muscle and advised treating it with ibuprofen and acetaminophen. Story 31. Starting around age 10, I began to have difficulty breathing. I would sporadically have intense, sharp chest pains that lasted less than a minute and forced me to take shallow, quick breaths. The only way to get through an episode was to take a very painful deep breath, which felt like it was popping something back into place. Because the episodes were unpredictable and medical tests were normal, nothing was done. 20 years later, a viral TikTok video suggested I had precordial catch. The precise cause is unknown, but it is a harmless condition likely caused by a pinched nerve in the rib cage due to slouching. Story 32. I noticed I was suddenly living each day feeling like doom was upon me. I was constantly tired and felt like I was in a cloud. I also noticed my periods became irregular after having been very regular my whole life. I wondered if this was just turning 30 or if something more serious was happening. It turned out I had hypothyroidism. My doctor took me seriously, ordered tests, and diagnosed it quickly. I still wake up with that sense of doom sometimes, but it goes away soon after I take my daily thyroid medication. Story 33. I had cluster headaches that started when I was 16. They got progressively worse each year until I was 23 years old, when they became nearly constant. I thought I had a brain tumor or something equally awful. It turned out I had a deviated septum pressing on a nerve entering my brain. My surgeon said it was the worst he had seen in his career. He had seen thousands. I had a simple septoplasty, and my cluster headaches were gone. Story 34. I had tingling in my fingertips that started to spread up my hands and into my forearms. I could almost shake it off, so I ignored it for a while. Then it started in my toes. I had all the usual blood tests for diabetes, vitamin deficiencies, and toxins. Everything came back normal. My neck was also becoming stiff. This went on for weeks, so I told my girlfriend I was looking for a neurologist to start a full workup. She asked whether it could be because she had been sleeping with her head directly on my neck. All symptoms cleared up within 10 days and never returned. Story 35. I spent my entire life unable to stay awake all day. It was so bad that even teachers who were used to students sleeping in class mentioned it to my mother with concern. My pediatrician said nothing was wrong. When I told my first doctor at 18 that I often could not drive without falling asleep or that I could not stop falling asleep after lunch, she told me that absolutely nothing was wrong and that it was normal to feel tired after eating and after driving following a long day. I believed that doctor and spent the next 10 years thinking I was normal until I moved in with a boyfriend at 28. He and 2 friends I traveled with that summer were alarmed at how intense it was and convinced me to press my doctor to get tested. By 28, I had a new doctor. I told her I did not want to be told no and that I wanted tests. She did not blink and said she would refer me to a sleep specialist. The sleep specialist took one look at me and knew immediately that I had sleep apnea. The sleep study confirmed it. She was genuinely shocked that I had been told my whole life that I was fine and that my first doctor had denied me testing and referrals. I am treated now. All good. Just sleep apnea. Story 36. I have spent a year reviewing my diagnosis, mainly looking at how many pieces fell into the puzzle of the health issues I have experienced. I have been chasing this for more than 25 years. I stopped eating last December because I was in a tremendous amount of gastrointestinal pain and had no appetite. This was alarming. I had had bouts of not being hungry before, but I always ended up eating. This time it lasted for weeks. I saw my doctor and was referred to a gastrointestinal specialist. I began testing, including an upper endoscopy and a colonoscopy. My wife knew that if they found cancer I would not fight, so she knew what to say if something happened. I woke up from the procedures. The doctor came over and said it was Crohn's disease. It was not cancer and it can be treated. It is not a minor condition, but it is manageable. Story 37. I was pregnant with my firstborn when I noticed a sudden growth under my left breast that had appeared out of nowhere in what I had been told was scar tissue from chickenpox when I was a child. It turned out to be a third nipple. Story 38. I have had styes my whole life, at a rate of at least 1 to 2 per month. I was at the eye doctor to get reading glasses, and as he was walking out he asked if I had any other eye-related questions. I told him about the styes and he said to take fish oil every day and they would be gone within a week. It has been 11 months without a stye. Story 39. I had terrible migraines for about 5 years. It got bad enough that I was in a very dark place, like telling my power of attorney to err on the side of pulling the plug too early if I stroked out. My best friend pulled some strings and got me in to see a new neurologist. She talked to me for 5 minutes, wiggled her fingers in my peripheral vision, and asked how many fingers I saw. I told her I was seeing double. She suggested idiopathic intracranial hypertension. The test and the treatment were a spinal tap. 1 spinal tap and a couple dozen spinal tap jokes later, I was mostly fixed. Once I got over the hangover, I had no headache for the first time in 5 years. I still get migraines, but not every minute of every day. I was also diagnosed with celiac disease because I became increasingly anemic despite being postmenopausal and eating a lot of steak. Story 40. I once had a severe ear infection in my left ear. It was swollen, full of pus, and I could not hear anything. After it finally went away, I noticed my hearing on that side seemed reduced and I became worried. I went to a doctor, had a hearing test, and everything came back normal. When I got home, I realized the problem was a broken earbud. Story 41. I started getting bumps in my groin. I was morbidly obese, embarrassed, and thought it was my weight. I had these bumps off and on for 4 years and lost the weight, but they continued. I finally went to the doctor and was diagnosed with hidradenitis. Those bumps are painful. I have to take 1 antibiotic a day for 3 months for my current flare, but it is easy to manage. I have tried to prevent them, but that is not working right now. My dermatologist says that once it is under control, it will be easier to manage. It is also tough on my mental health, but I manage. Story 42. I've dealt with chronic exhaustion my whole life. Even after being diagnosed and receiving proper treatment for my mental health issues, the lack of energy would not go away. Turned out I was vitamin D deficient. I live in the upper Midwest and my main hobby is playing video games, so it made complete sense and was the simplest explanation. 1 blood test to check my levels and a prescription dose of vitamin D did the trick. My level was 8, and suddenly I was no longer exhausted at 2 p.m. Story 43. This does not quite fit the prompt, but I began having severe abdominal pain with nausea and diarrhea when I was 5 years old. I had just moved schools, so at first my mother thought I was faking the pain to avoid school. As the symptoms persisted, she took me to the doctors. I underwent many tests, blood tests, a stool sample to test for parasites, because we had cats and I used to put their paws in my mouth, and an ultrasound for which I had to fast and drink a large amount of water beforehand. Eventually, the doctor told me to eliminate dairy for a couple of weeks to see if that helped. Turned out I am lactose intolerant. Most people who are lactose intolerant stop digesting lactose around age 5. Story 44. My chest felt very tight. I was short of breath and had a sense of impending doom. So, like a responsible adult, I went to the emergency room after about 2 weeks of symptoms. All tests were normal. It was most likely severe anxiety. The emergency room staff were not impressed. Story 45. I had a very concerning-looking mole and thought it might be cancer, but I never got it checked. After I had a baby, I finally had it examined, and it turned out to be a skin tag. Story 46. I had been exhausted for almost 20 years. It turned out I had a mild vitamin B12 deficiency, and it was easily resolved with over-the-counter vitamin B12 supplements. Story 47. After the pandemic and having never caught coronavirus disease 2019 when it first appeared, I had my usual fall allergies and sniffles. This time it felt much worse and did not get better. Normally this lasted about 3 months each year and was not serious, so I toughed it out. 6 months later I went to urgent care. They gave me an albuterol inhaler and recommended I see an asthma specialist. I worried it might be something serious because I had not had asthma as a child and I never smoked. I saw an asthma specialist a few days later. After the tests, the specialist reassured me it was asthma and the daily medication worked wonders. I also learned that after childhood, the late 40s is the most common time to receive a new asthma diagnosis. Story 48. I had a lump at the top of my calf, and a Google search only returned alarming explanations. For months after noticing it, I finally summoned the courage to see the doctor and get magnetic resonance imaging. The scan showed a torn meniscus in my knee from when I mildly injured myself doing jumping jacks almost a year earlier. The torn meniscus allowed synovial fluid from the knee joint to leak into the top of my calf. I had that magnetic resonance imaging 10 years ago, and the meniscus still leaks joint fluid into my calf. The doctor said surgery would be more painful and invasive than leaving it alone, although my knee aches there occasionally. Story 49. I had a small light gray spot on the iris of my eye that seemed to be getting bigger. I worried it was a tumor or something pressing outward. I finally went to an eye doctor because it appeared to be enlarging and was told this is a consequence of aging. It is just thinning of the tissue and nothing to worry about. It will continue to get larger over time. Story 50. I have hidradenitis suppurativa. I was always told it was autoimmune, incurable, and that not much could be done beyond self-care and diet. I dealt with it for over 20 years, and in the last year I kept flaring. It became very painful, so I finally saw a dermatologist, expecting to be told to keep doing what I had been doing. Instead, the doctor put me on a long course of powerful antibiotics, gave me a topical ointment, and recommended vitamins to reduce inflammation. The change has been dramatic. I had been following outdated medical advice, but it is now under better control than it has been in my life, and I am in my mid-40s. Story 51. When I was a teenager about 20 years ago, I picked up threadworms. I would have been about 15. I had no idea how I caught them, but I was mortified and ashamed. It took me over a year to tell my mother that I suspected I had them. She did not bat an eyelid. She just booked me a general practitioner appointment. My general practitioner prescribed 2 pills, and the infection was gone. I had suffered that discomfort for over a year, imagining my intestines teeming with parasites and dealing with nightly itchiness. All it took was 2 pills. Story 52. My heart rate would spike to 150 to 180 beats per minute just from standing or walking up a few stairs. It also happened after eating. I eventually figured out, with no help from the doctors, that I had a hiatal hernia. I did deep belly breathing for a few minutes per day, and the symptoms did not return after the second day. Story 53. This is a story I read. A woman had bad body odor. Nothing they tried could fix it. Finally, one doctor took the time to sniff all over her body to identify the source. It turned out to be bacteria living under her wedding ring. Sterilizing the ring in an autoclave for a few minutes fixed it. Story 54. I had extremely severe menstrual pain, but I considered it fairly normal until I had my copper intrauterine device removed and the pain became worse. I saw a doctor over the next year or two, and we discussed the possibility of endometriosis, but we did not pursue treatment because of the risks of surgery. 3 years later, the pain was bad enough that I could not sleep at night, and I had also started fertility treatment. At that point, a doctor told me that my pain, which was severe enough to prevent sleep and at times made me feel suicidal, could be caused by fibroids. I scheduled surgery almost immediately and felt completely normal within 2 days. I now have a toddler who is almost 2 years old, and I have not had such low levels of pain since my preteen years. Story 55. I knew a woman who had worsening respiratory symptoms over a long period. She did not seek medical care because she was a heavy smoker and assumed it was lung cancer and that nothing could be done. It turned out to be tuberculosis. She could have recovered. Story 56. I was bitten by a brown recluse spider in my early 20s. For 20 years I have had irritated, occasionally itchy skin on my leg. It began swelling slightly, so I finally went to the doctor. The doctor prescribed a topical steroid and antibiotic ointment, which cleared it within a week. I have significant scar tissue on my leg and some cellulitis, but it no longer itches and the irritation is almost entirely gone. Story 57. I was exhausted, my joints hurt, and I had hot flashes and night sweats. I put up with it for 3 years until I finally decided I needed to find out what was wrong. Routine blood tests showed my thyroid was out of balance. I feel much better now that I take hormones daily. Story 58. All my life I was told I had a weak immune system. I had terrible colds that always required antibiotics several times a year. Yet I never had the flu and did not catch the viruses that went around at school. 5 years ago, a doctor suggested that the opening to my sinuses might be too narrow and confirmed it with a computed tomography scan. After one simple surgery, I have not taken antibiotics since. Story 59. That cough I thought was allergies and would not go away. It was asthma. Some people do not wheeze, they cough. Story 60. I noticed one night that my hands were yellow, like jaundice yellow. I freaked out, washed my hands, but the color would not come off. I called my mother in a panic. She told me to go to bed and call her in the morning. I did, took a shower, and my mother took me to the doctor. The doctor looked at my hands and noticed the yellow was only on my palms and fingers. You have something on your hands. Go wash them and see if it comes off. It did not. He fetched Comet and said, "Try this." I scrubbed my hands and they were less yellow. That is when it dawned on me. I had cut a container of yellow bell peppers that had condensation on them. Somehow the pigment transferred, especially when mixed with other bell peppers. We all had a good laugh. It took a few days to disappear completely. To this day, he asks if I have had any yellow bell peppers recently. I have not touched a bell pepper of any kind since then, unless I am double-gloved. Story 61. I had many issues: insomnia, aching joints and bones, and a diagnosis of clinical depression. When my insurance changed, I had to get a new doctor. At one visit, he ordered a vitamin D test as part of my blood panels, something no other doctor had requested in over 10 years. I had a severe vitamin D deficiency. Once I started taking vitamin D daily, my bones stopped hurting, I could sleep again, and my depression, which had become so severe that I had reached the maximum dose of a selective serotonin reuptake inhibitor, improved enough that I could stop the medication, which was causing bad side effects. After 10 years, all I needed was a vitamin D supplement. Story 62. I thought I had bad gas bubbles. I assumed it was a normal thing that happened to everyone. Every so often I'd eat something that upset me, and I'd spend the rest of the night in pain. I had a stabbing pressure under my ribs and in my abdomen that I thought was a large trapped gas bubble, and pressure and tightness in my chest and back that I thought was heartburn. Eventually I would fall asleep and wake up feeling better, so I assumed I had passed the gas. I had these pains occasionally before I got pregnant, but they became much more frequent after I gave birth. The last time it happened, I was in pain on and off for about a week. One night, I was curled up on the floor, unable to move, still thinking that if I could just pass this gas, I'd feel better. 3 days later, I called out of work and went to urgent care, thinking they would give me an over-the-counter gas medication or a laxative. They sent me for imaging. It turned out I had been having gallbladder attacks, and this most recent one had progressed to pancreatitis. The urgent care doctor told me to go home, pack a bag, and get to the emergency room as soon as possible. He was right. Within 2 hours, I went from walking into urgent care with a tummy ache to being doubled over, yelling in pain, and vomiting on the floor. 5 days in the hospital and 1 gallbladder surgery later, I can eat whatever I want. There is also a connection between recently postpartum women and gallbladder issues that apparently nobody talks about. Story 63. I started having episodes of intense itching all over my body, especially on my chest and upper back. I noticed a rash and went to urgent care, where they told me it was just folliculitis, which is typically not itchy, so they thought the itching was unrelated. An allergist diagnosed me with chronic spontaneous urticaria without hives and prescribed a very high dose of antihistamines. 10 months later, I was home for winter break and asked my mother to look at my back. It was completely covered with red spots. I finally went to a dermatologist. She said it was a specific type of folliculitis called pityrosporum folliculitis, caused by an overgrowth of yeast on the skin, a non-contagious fungal infection that, unlike regular folliculitis, is very itchy. She gave me an antifungal cream and it cleared up after a month or two. Unfortunately, the chronic urticaria diagnosis was also correct. I have it as part of what is probably a mast cell disorder, so treating the folliculitis did not completely resolve the full-body itching, and I ended up needing stronger medications for that as well. Story 64. I had sleep problems. I was always tired and constantly yawning. Nothing helped. Several doctors over the years told me that was normal and to do more things, and other people said that everyone is tired. I was beyond tired. I was so exhausted that as soon as I hit the pillow, I was out. One 10-minute conversation with a sleep specialist changed everything. He told me I have narcolepsy. I did the tests and I definitely have it. The scary part was cataplexy. I thought it meant I would be paralyzed for years. Sometimes I wake and cannot feel my legs. There is no tingling, nothing. My legs simply feel like they do not exist. I have fallen when trying to take a step and smashed my knees on the floor. I thought it was odd but not serious. I feared I might become paralyzed because no doctor had taken me seriously. I was diagnosed at 29. I have been dealing with this since middle school. Story 65. I lived with chronic sinus infections throughout my 20s and 30s. I had an abscess on a tonsil and had my tonsils removed. I have not had a single sinus issue since. It was the best unexpected perk of the surgery. Story 66. Not exactly solved with a quick trip to the doctor. When I was a senior in college, I had crippling anxiety. I don't mean just getting a little nervous. I had wild dreams and woke up in the middle of the night with full-fledged panic attacks that lasted hours, with shaking, fainting, sweating, and extreme vertigo. During the day, the slightest thing could trigger an attack. Missing an exit on the highway, meeting a professor about a grade, or being slightly late to work. The attacks were so bad I often vomited multiple times per week, which I absolutely hated, and I started losing weight rapidly because I was afraid of throwing up. My hair was falling out, I was exhausted all the time, and my lips were pale. When I mentioned it to the doctor, she asked if I had an eating disorder and otherwise chalked it up to the stress of my final year in college. I weighed 97 pounds. This felt like more than stress. This went on for 2 years and I thought this was my life. Then I went on vacation for 2 weeks and forgot my birth control pills. I called the doctor and asked if she could forward a prescription to where I was, but she told me to go without and start a new pack next month. A few days passed and I noticed I did not have any panic attacks. Things that would normally trigger me did not cause issues. I slept through the night and did not vomit at all. I thought I had just needed a vacation. When I got home and started the new pack of pills, within 72 hours I had my first panic attack with vomiting. It dawned on me that the birth control pill might be the cause. I immediately scheduled an appointment, and the doctor switched me from the pill to a vaginal ring. All the panic attacks stopped. It turned out to be the high hormone pill I had been taking. Years later, I got an intrauterine device and worried the hormones would trigger issues again, but after about 15 years I have had no problems. Story 67. I woke up violently ill every morning for almost a year. I saw multiple doctors with no answers and did everything I could to alleviate it. Changing my eating habits, not eating at night, drinking more water, and more. It would go away temporarily but would come back full force after a few days. I wanted to test it by not eating anything for 24 hours. Lesson learned the hard way. I woke up incredibly nauseous and vomited so hard I tore a lesion in my esophagus and then vomited bright red blood. I went to the emergency room. One of the doctors asked about my symptoms and whether I ever got headaches when this happened. I said yes, daily. He then referred me to a neurologist. After some testing, the doctor found that I had been suffering from untreated depression and anxiety since childhood. And my body was literally manifesting symptoms to tell me that my brain had mistreated it for 25 years and was about to be severely punished. I was prescribed medication and have felt much better for the last 10 years. Do not ignore your body. It will find a way to tell you something is wrong. Story 68. My depression seemed to be getting worse even with therapy, until I had to stop when I moved to another state for college. I always thought my mom was just being odd, but it turns out Montelukast, which I take for asthma, can cause depression as a long-term side effect. I stopped taking it, started antidepressants, and am feeling better. Story 69. I had a hard lump in my breast that throbbed with pain and felt like it was on fire. It was extremely tender to the slightest touch. The hard tissue eventually softened, and no breast cancer was found. Story 70. I saw doctors over the course of 8 years with classic anemia symptoms. None of them took it seriously. I took my health into my own hands. Thinking that United States healthcare was not going to help women, I paid for my own laboratory tests out of pocket. The results showed anemia based on ferritin, iron, and other serum measurements. I am now following my own protocol to treat the anemia that triggered psychosis and panic attacks 3 years ago. This is alarming and sad. My experience is not uncommon for women in the United States. Story 71. I had swelling in both armpits throughout my early 20s. Came and went, but around 25 it became constant. I had started working in a tax office and had to wear a shirt and tie. A year later we were expecting our first child, and I went to the general practitioner. He listened to my story about my armpits and gave me a grim look. He said we should stop and discuss it in depth. I have now been seeing this general practitioner for over 30 years, but at the time I had only been his patient for about a year. We were both young, and he did not have much of a poker face or bedside manner. He referred me to an internist and an oncologist. My armpits were examined. They were poked and prodded and scraped somewhat, but no biopsy was taken. They left the room. 10 minutes later, the internist returned and asked what kind of deodorant I used. It turned out I had been using a deodorant I was allergic to for most of my life. Story 72. I have to say, as someone with medical anxiety, this thread has been so calming to read through. I was laughing a lot. Story 73. My wife developed polycystic ovary syndrome, type 2 diabetes, and fibromyalgia. No one in her family had any of those conditions. It turned out that these were caused by exposure to aqueous film-forming foam while she served in the Navy. Aqueous film-forming foam is a firefighting chemical in the per- and polyfluoroalkyl substances family. Story 74. My right breast became red and swollen. I feared inflammatory breast cancer. 2 doctors appeared alarmed. An insurance issue delayed my mammogram for 6 weeks. My primary care physician called weekly urging me to keep the appointment, which made me extremely anxious because I could not change the date. I expected terrible news and a poor prognosis. It turned out to be an infected seroma, a sac of fluid that did not respond to antibiotics. They prescribed a stronger antibiotic, and it has been fine since. Story 75. Starting in middle school, I had episodes of coughing and choking fits. If I had a cold, was stressed, or had a busy schedule, I would get attacks where the back of my throat suddenly felt dry and began to close. I would cough and choke, with eyes watering and nose running, until I got water or a cough drop. The episodes were clustered but sporadic, sometimes not occurring for months, but lasting for weeks when they did. As I got older, I explored several ideas and brief diagnoses, but it never lasted long enough to pin down. Endoscopic examinations and a nuclear medicine study found nothing, and I had no allergies. Then I contracted coronavirus disease 2019, also called COVID-19. A few weeks later, the problem ramped up dramatically, horrible fits bringing me to my knees every 1 to 2 hours. I had to sleep upright with a cough drop tucked in my cheek. It was absolute misery. My gastroenterologist thought the problem was gastroesophageal reflux disease and put me on increasing doses of proton pump inhibitors, for example omeprazole sold as Prilosec. That only made things worse and caused significant anxiety. I changed my diet, bought wedge pillows, and used antacid tablets, but nothing helped and the symptoms continued to worsen. I finally saw an ear, nose, and throat doctor to evaluate for pharyngolaryngeal reflux. They asked about postnasal drip. I said I was not aware of it. They scoped my sinuses and throat and found my sinuses about 50% swollen shut with a wall of mucus running down the back of my throat. They gave me sinus rinses and a month of a specific antibiotic. Within a week, the symptoms cleared and they never returned. Our conclusion was that I had a persistent sinus infection that went latent. When it flared, it caused drainage and postnasal drip that I had become used to and did not notice. The mucus reaching my stomach likely altered the pH and increased acid production, leading to reflux. I used to have frequent heartburn. Now I rarely do and only after clearly triggering meals. Lesson learned. Get evaluated by different specialists. The body is a set of linked systems, and an issue in one system can cause symptoms in another. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.